Hello and welcome. Thank you for taking this opportunity to learn more about Misericordia's employee benefits. Here we have a presentation with regard to the Low PPO plan. Here you'll find a presentation that we have developed to provide further explanation with regard to the Low PPO plan. PPO stands for Preferred Provider Organization. This plan, along with the other two medical plans that Misericordia provides to its employees, accesses the Blue Cross Blue Shield network of Illinois and the National PPO network. Blue Cross Blue Shield of Illinois network is the largest, most accepted insurance carrier provider network in all of Chicago. Now we'll review the employee levels that are available with this plan. Employee-only coverage with this plan is just $50.09 per paycheck. Misericordia contributes $200.35 for this plan per paycheck. The annual employee cost for this plan is just $1,302.29. Misericordia contributes towards this plan $5,209.15. You'll notice there's 4 levels here. You can also add your spouse to the plan. Spouse is defined as any legal spouse. And then you can also enroll your children, and you can enroll your family. Family coverage is your spouse and children. Please note with children that they need to be a legal dependent of yours, and they can be on the plan until they're 26 years old. At the end of the month, when they turn 26, they'll be dropped from this plan. This Low PPO plan is the most affordable plan that Misericordia offers. Because it's the most affordable plan, the premiums are the lowest, and the deductible and the out-of-pocket limit is the highest. What this means for you and what you need to understand is that this plan has very little first dollar coverage. The deductible for this plan is very high, and the price of the premium is reflected in that. That's why it's so much more affordable than the other two plans that we have to offer. The deductible for this plan for individual and network is $1,500. The family and network deductible for this plan is $3,000. Remember, the deductible is the amount you pay before the insurance carrier makes a payment. This plan also has out-of-network benefits. The out-of-network deductibles for individual and family are double that of the in-network deductibles. After the deductibles have been met, we then move into coinsurance. Coinsurance is the shared cost between the carrier and you, the subscriber. When you go in-network, your coinsurance is 80%. That means that the carrier pays 80% and you pay 20%. For out-of-network, the coinsurance is 60%. The carrier pays 60% and you pay 40%. You pay the coinsurance until you reach the out-of-pocket limit. The out-of-pocket limit for this particular plan in network for an individual is $3,000. The out-of-pocket limit for in-network family is $6,000. It's important to note that your deductible is subtracted from the out-of-pocket limit. So the last of the out-of-pocket limit you have to meet is minus the deductible. So in this case, the out-of-pocket limit remaining is $1,500 for individual, for in-network, and $3,000 for family in-network. And those amounts then are doubled for out-of-network coverage. When you go in-network, your benefits have greater value. When you go out-of-network, your benefits have less value and you have to pay more money. Out-of-pocket limit, it's the most that you'll pay in a plan year from January 1 to December 31st. After that, we'll review the primary care physician visits and specialist visits. Because this plan has such a high deductible and a low premium, you also do not have copays with this plan. When you go to the doctor's office or to see a specialist with this particular plan, you are responsible for 100% of the cost until you've met your deductible and your out-of-pocket limit. It's very important to know that. You don't want any surprises when you go to the doctor's office and you realize you're responsible for 100% of the visit. After you've met your deductible and your out-of-pocket limit, you will no longer have to pay anything for your doctor's office visits. One saving grace that's attractive to this particular plan, since there's no first dollar coverage, is that you still have access to urgent care. Urgent care costs $40 per visit with this plan and is considerably cheaper considering if you went to your doctor, you'd be paying for the entire visit. Urgent care is the most affordable option for medical treatment that requires urgent attention that you would usually get if you went to a regular doctor's appointment. If you have a true emergency, you should go to the emergency room. With services such as diagnostics for lab and x-ray, this is going to be just like a doctor's office visit. You're responsible for the deductible and the coinsurance before the insurance company starts paying anything towards these costs. Another nice feature of this plan is that it has adult preventative care. All three of our plans have adult preventative care that's covered at 100%. This is good news for Misericordia employees because we as employees at Misericordia are required to get an annual physical. You can get your annual physical for free through this adult preventative care. It's covered at 100%. Remember, these annual checkups are covered at 100% in network. But if during the appointment you request additional care other than what is covered under your annual preventive care, you will be subject to meeting your deductible coinsurance until the out-of-pocket limits are met. Well child care works in the same way as adult preventative care. With this particular plan, as it relates to emergency room visits, you're responsible for 100% of the cost of the emergency room visit until you've met your deductible and coinsurance. Chiropractic services are also offered for this plan. However, it's limited to 25 visits per year. And just like other services I've mentioned, you are responsible for 100% of the costs until you've met your deductible and your coinsurance and your out-of-pocket limits. Now, this plan doesn't offer a lot of first dollar coverage, but when it comes to prescription drugs, it offers the best plan of all three plans that we have to offer. There's an option for monthly copay refills on prescriptions, and there's an option for mail order. The mail order is through CVS Caremark Pharmacy. With the 30-day supply, you have a copay that'll cover you for the 30 days. With mail order, you have a copay that applies, and it's best to look at it as with the mail order, you get 3 months supply for 2 months the cost. For example, with the generic medications, it's a $10 copay for a 30-day supply. Generic means that the original drug manufacturer has lifted the patent on these drugs and they can be made by other pharmaceutical companies at a more affordable cost. It's $10 for 30-day supply and it's $30 for a 90-day supply. Next, we have brand formulary preferred. For the brand formulary preferred, you pay $30 for a 30-day supply and you pay $60 for a 90-day supply. These drugs are still being made by the pharmaceutical company that holds the patent. Even though they are brand name, your insurance company and the manufacturer have negotiated an affordable cost for them. The last tier we have, as it relates to prescription drugs, is brand non-formulary, non-preferred. There's a $50 copay for a 30-day supply, and there's a $100 copay for a 90-day supply. These drugs are still being made by the pharmaceutical company that holds the patent. There is no negotiated price between the carrier and the manufacturer. Therefore, these medications have the highest copay. Please understand that this is just a brief summary of the benefits and the rates. If you'd like a more thorough review, in-depth coverage of what this plan entails can be found in the Summary of Benefits, the SBC. The SBC can be located in ADP, very much like the way you'd find this video. You log in, click on Resources, Forms Library, and scroll down until you find the SBC for the plan you are interested in learning more about. We've developed a fact sheet regarding the low PPO, frequently asked questions. What does low PPO mean? Low PPO means preferred provider organization. Low means the lowest premium and the highest deductibles and out-of-pocket maximums. Why is this premium the lowest? The plan has an in-network individual deductible of $1,500 and $3,000 for family. Out-of-network is double that. This means that when you see a provider for an office visit and have labs or x-rays outside of the preventative care appointment, you are responsible for 100% of all costs until you reach the deductible and the out-of-pocket maximums. What do employees like about this plan? This plan has the lowest premiums. Prescriptions are covered with affordable copays. The plan offers urgent care visits for just $40. What do employees dislike about this plan is that the plan has a high out-of-pocket cost associated with it. Who is this plan good for? This plan is good for individuals that enjoy low premiums and are financially prepared to pay high deductibles and maximum out-of-pocket costs for non-preventative care. Thank you for reviewing this plan. We want you to be well informed as it relates to your health and wellness. If you have additional questions about this plan or any other benefits listed below, please contact Human Resources. Again, this is Joseph Young, and I'm the Benefits Manager here at Misericordia, and I can be contacted via the information I've provided below. Thank you.